just a little bit about me. My name is Darlene. I have been doing this for a very long time. I've started out doing a lot of medical school consulting for the past 7 years, and a lot of my students have gone on to like really high level places like Dartmouth, UCSF, Tufts. And so we just got a Mayo Clinic interview, which was super exciting for me. And then a lot of that translated over to my BSMD experiences as well. So I'm one of the very few people who has pretty much seen applicants get in at almost every program. So, I am also a physician. So between those two things, I feel like the advice I tend to give people is a little bit different. So throughout this whole, you know, um, seminar, you'll hear me say things like, you might see things in blogs or YouTube because I know all the things that you guys are reading. I don't agree with everything. And so, a lot of this is my personal opinion and my specific experiences with what I've seen actually works. These are just a little bit about our services. So again, there was a lot of things I can say about interviews. I've been thinking about like, do I want to do more like seminar type things? So I guess you guys can help me decide if this was actually helpful for you. If you are my student already, some of this might actually sound very familiar because this is like the same way that I would teach you guys in interview prep or like as we're writing essays. But again, today we're going to try to focus more on like how to actually prepare common questions that you might see and like, how to navigate them and then different strategies to take as well. So the first thing is that I want to personally address is like the timeline. If you came to my seminar before, this timeline might look a little bit familiar. So I know there's a lot of anxiety surrounding like, I didn't hear back from Penn State or like I didn't get accepted into Penn State or what's going on with New Jersey, is Pitt coming out? I'm on Reddit. I know you guys are on Reddit. And so we see a lot of these types of questions. I would just say be really careful about like where you're getting your information. For me, I get my information directly from admissions offices. Like I have no problem emailing them myself. But I also know the specific patterns. I've seen people say like false things like, oh, I already got Albany, right? Like Albany is not even out yet. So just be really careful and don't really fall into the traps of listening to what other people have to say. The season has barely started. So if you are freaking out, and I totally understand like what you guys are going through because I go through this every year with my kids. The season has barely started, right? NJIT has started rolling out some interviews. I fully expect them to have at least another wave of interviews. It may be the last one, but that's what I'm anticipating. Penn State has not released any invites yet. They've released several rejections. Historically, you would hear back around mid-December if you're going to get invited. Other things to kind of look out for around this time period is Pitt may come out in like the next 2 weeks or so. And AMC meaning like Albany, may also come out in like the next few weeks. So other than that, it's going to be radio silence for quite a while until we get into January. And that's actually where you're going to hear about most of your interview invites. Some of the schools are not very good at telling you whether or not you're going to be rejected. So, you may not know, but also understand that some of these schools also come out in waves, right? NJMS is a great example of that. VCU, I think, also has some waves, and especially Albany, like definitely has waves. So if you're not hearing back, don't panic right away. I know waiting sucks, but they're still getting to your application, essentially, okay? The reason why most of you guys are here is how to actually prepare for interviews. Um, so there's a lot that I can say, but I kind of wanted to kind of keep this brief and succinct. So the best things, I would say these are the best things that I can think of that you can do to prepare. I always have my students review their essays and resume for the specific schools. Reading your essays is a nice little refresher about what you actually wrote that may have captured their attention, right? They may also ask you about specific things in your essays. So it's really important to remember like what exactly you wrote and why. For your resume, especially, I know you guys know your resume like inside and out, but they may want to pick specific points like, tell me about this interesting activity, right? For these types of questions, they're not necessarily going to be common things that you see, like shadowing or volunteering. You may get a question about research, and if you do, they're trying to test, like, what was your actual engagement? Like, did you go to a pay to play? Like, did someone just slap your name on like an abstract or like a paper, or did you actually like physically put in work? And so it's really important for you to understand how to present that information. And also, I would encourage you to try to think about a story or some specific point that you want them to know about each of your activities, just in case they ask them. In terms of looking into the program you're interviewing for, I know this sounds so obvious, but I feel like everyone does this like the wrong way. The most common way that I think people look into this is like, I really want to work with Dr. Smith, right? And I know you guys do this because all the blogs tell you to, all the YouTubers tell you, like, make sure you really look into this one specific person. Um, is it life changing if you tell me like you want to come to my program because you want to work with Dr. Smith? Not really. Remember, you're going to these programs to get an education, right? So something I really hammer in, and again, all of my students like know what I'm about to say. You have to know the mission and the curriculum. If the only point you can come up with is like, I want to work with Dr. Smith, that's not nearly as strong of a reason to go to that specific program. And also, the mission is super important because you could be the best applicant ever. Like, let's say you have a 1600 SAT, you have a 4.0, you've done like, 1,000 hours of like volunteer service and you publish like 10 papers, right? I've just, by the way, like no one's actually doing that, so don't freak out if you're like, I definitely did not do that. If you if you think about that mission and let's say your spiel is, I really love research and I really can't wait to come here and work with Dr. Smith, and you're interviewing at UMKC where they don't care about your research, right? They barely care about your grades. They are here to see if you're going to be a good fit to be a community doctor. Again, you could be the best applicant ever, but you're not going to succeed in that interview because they may not have something that they feel like they can train you for. So by aligning your specific goals with their mission, it helps them see like, okay, this is someone who I think can really thrive at this program. Just because you're a good candidate doesn't mean that you're a good candidate for a specific program. Another point to bring up is like practicing. Um, a lot of people, I think, have different ideas of how to practice, and I'm not really here to tell you like one way is better than another way. Um, I would say practicing with like mentors, and I'm very specific about like your mentors are not necessarily like teachers. Like, I've worked with like BSMD consultants before who are like high school teachers, right? I personally don't think they know anything about medicine. Like they may know about like how to answer some questions, but like they're not going to be the most helpful in like helping you really nail like how to answer these like medicine type questions. But I would say they could be very helpful in like helping you with delivery. Parents can also be really helpful. I have a lot of parents who like, train their students offline as well. Like we it's kind of like a teamwork, right? Like I do the mock interviews, I give them feedback, I give them questions to practice with. And the parents, like, again, they may not know about medicine, which is fine, but they can help you at least articulate. If your parent does not understand what you're saying about like, how you would be a doctor, or like if you had to explain a healthcare issue to them, right? And they're like, I'm not totally getting, what you're putting down, then you know that you need to work on delivery. So in those cases, like you don't need a professional per se to like help you. But it is really important to make sure that you're able to articulate, like especially things like about your resume or life experiences. Um, Coaches is, I don't know. I definitely feel a certain type of way about this. With coaches, like, especially if you guys like did find me on Reddit, right? Like you guys are about to get bombarded like no tomorrow about like everyone who's like, I'm a first year BSMD student and I want to help you with your interview prep. And coaches like suck, but like I want to coach you. And so just something to keep in mind is that what worked for somebody may not necessarily work for other people. So a first year BSMD student is not necessarily super qualified to like make sure you know how to like actually navigate the interview process. They may know some of the questions, but I don't know, like, I mean, trust me, I know a lot of questions, right, for a lot of these schools, but I don't ever teach my students to like only bank on those questions because you just never know what they're going to ask. For example, last year, UMKC and Drexel changed up their questions, right? So again, my students were all fine because we prepare for everything. I never just rely on last year they asked this, and so this year we're only going to practice for that. NJMS is like also a great example. Depending on who you ask, like some people come out of that interview being like, it was great. Like we vibed so hard. I have a really good feeling about this. We talked a lot about like these experiences and I really bonded with them. In the same year, other people are like, oh my God, I got grilled so hard on these specific questions about healthcare or like why I want to do medicine. So you just want to be prepared for everything and anything. Never take someone's experience and feel like that is what you should expect. You will shoot yourself in the foot that way, okay? You want to be really, really careful and make sure that someone who's going to coach you understands how to actually help you navigate some of these questions, especially like the more challenging ones. I think pretty much anyone can like say things about like, tell me about yourself or why medicine, but there's a lot more to that than just those questions. And we'll talk a little bit more about that in some of the later slides. The last thing is recording yourself and watching it back. I think a lot of people find this very awkward. Like last year, I definitely had some students who refused to do this, but I will say it makes the most dramatic difference. I can definitely think of a student who interviewed at a very high level school. And my issue with his interview was that he was just very like monotonous and he was saying the right words, but the delivery was not good. The next week when I saw him, he made such a drastic difference, and I was like, what changed? Because I was like, clearly like something changed because he was just like significantly better. And he said that it was because he watched it back and he was kind of appalled by like the way that he was performing. So he was like, in my head, it sounded great. Like I felt like I was doing everything right. But like when I watched it, like I totally saw like what you were saying. And so it just helped him become more cognizant of, his delivery, like his mannerisms, the way that he actually spoke. And so that's something that I would encourage you to do. If you read like my blogs, some of my students have written articles for me talking about their experience with like basically the whole process. But in the interviews, like you'll actually see, they did talk about recording themselves, practicing with parents and things like that. So As you're thinking about like, where do I start? That's where I would start. So I got a lot of questions about like what to expect in the different types of interviews. And I think the biggest, or I guess not the biggest, but like the most questions I got about was for MMI. So we'll start with like the traditional and then we'll go into a little bit about MMI. So the traditional is going to be most of the types of interviews that you're going to see. Typically, it is one-on-one. Occasionally, like if if you're applying to UCSF Fresno, which is my program, by the way, you may get like a panel interview, but I would say a panel interview is actually kind of rare. If you're applying to somewhere like Nova or LECOM, then um, you may see like group interviews, which personally I feel like that's my least favorite type of interview. But again, the most common one that you're going to see is going to be these one-on-one interviews. And I think the point I just want to highlight is that they are just there to get to know you. I think given the competition, I think it's really easy to feel like everything is a trap nowadays. Like, they're asking you a question, it's not always a trap. They just want to understand like what are your goals, what brings you to this program? How do you see yourself in this program? And you know, if they're asking you a question, again, it's not necessarily to like trick you or like try to get you to say something wrong. Try to think about it in a way of like, they just want to get to know me, right? So I put these three key questions because these are, in my opinion, the most important questions that you will get asked. If you don't know how to answer them, well, I wouldn't really expect good results. Um, Tell me about yourself is really important because it sets the precedent. Please don't be one of those people who just reiterates their resume. Like sometimes I get people who are like, "Hi, I'm John, and I have done a ton of research, and my research is in blah blah blah." And I'm just like, okay, like what else, right? You will read very different things about how different people want to approach this question. I try to approach it as more of like a 30-second snapshot, so more holistic. Some people talk about like, hey, you should incorporate like some of the why medicine in there. I personally don't think so. I think you should come across as a person first before you talk about medicine. And plus, there's a whole why medicine question. For the why medicine question, again, I know that you guys have like a ton of anxiety around this and you're like, where do I start? Even though I wrote like, 500 essays on why medicine, articulating it is definitely a lot different. Depending on how you wrote your why medicine, you may be able to follow an outline, but I'll say like new students who come to me, sometimes the why medicine isn't written in the best way. So my best advice to you is try to just go in chronological order and also have a goal. If you don't have a goal, it's very hard to understand what you're going to do in medicine. And I get this question a lot, like, what do you mean by goals? By goals, I don't mean like, I'm gonna be a neurosurgeon, right? Like there's a long way to like get to becoming a neurosurgeon. But I really do mean like if you are in that clinic, like how do you see yourself delivering care? How do you see yourself contributing to the field of medicine? I think some people definitely struggle with this question a lot. Not necessarily why medicine, but like what are your goals? If you don't come in knowing what your specific goals are just yet, the whole interview, like not even just for this question, but your entire interview is going to feel very unconfident, or it's going to come across as if you're not sure about the realities of medicine, right? Like I get asked all the time, what makes somebody stand out? It's someone who's very self-assured, right? someone who has not just done the work, because if you're applying, you guys have all done the work. So it's not necessarily like, oh, like you didn't volunteer enough or shadow enough, right? Like you've done those things, but um, I think being able to articulate what your specific goals are and how you see yourself practicing in the future is going to be extremely important. For the YR program, again, we talked a little bit about this. Try to think beyond just Dr. Smith. Okay. Okay, so for MMI, I'll show you guys some examples of like different questions, but these are pretty much what you guys should expect in terms of like the different types of questions. With MMI, if you've never heard about this before, it's really exactly like how it sounds. They're like mini interviews. So like you have different stations, you'll get a specific prompt. You'll have about 2 to 3 minutes to think about the questions. They usually will specify in like your interview invite about like what the timing is, because it does vary a little bit per school. They'll give you a specific prompt at that station. You think about it for like 2 minutes, and then you answer for about 6 minutes. My biggest advice is like you're not talking for 6 minutes. I would try to keep your answer no more than like 2 to 3 minutes, and then just realize like in those 6 minutes you're gonna have follow-up questions. Okay. The different types of questions you might get is healthcare, ethics, or situational, or you may also get a traditional question, right? So one of the biggest mistakes that I see people make is if you're getting a traditional interview, some people are like, okay, like I'm safe from ethics. That's not true. You can get an ethics question in a traditional interview, and in your multiple mini interview, you can also get some traditional questions. So you have to be able to prepare broadly for both types. And then I just wrote some best ways to practice. Mock interviews, obviously, we've talked about this already. Understanding healthcare and medicine. This is so important. I will say not every school will really harp on you for this. All of my students, I do harp them for this, because if you guys come to me, I'm not letting you go into the interview without actually knowing about healthcare. I get asked all the time about like specific resources, and I mean, trust me, like if I had good resources, I would share them with you. It's just I haven't found a good one that is like high yield specifically for interviews, but is not also like super dense in information. Like if you're gonna interview at VCU, for example, you only get a week to practice, right? So it's really hard to kind of cram like, everything about like insurances and like all the issues in like the healthcare system into just 1 week of practice. So, as you guys have time right now, I highly encourage you to start looking things up. ChatGPT, I think, can be super helpful in helping you outline some of these things. I personally have not tried it myself, but I would imagine they would be able to actually pull different articles for you to actually understand the healthcare system in general. Again, not every school talks about this or will ask you, but I will say, like, my acceptance rate tends to be pretty high, and I think it's because all of my students are able to articulate issues in healthcare really well. And even if they don't get asked it, like they try to at least introduce it in different things like the why medicine, or like even why our program, right? Talking about like they feel really passionate about this specific issue, and like, this is how they see themselves targeting it at that specific program. So again, it just makes them come across as really self-assured, like they really know what they're doing here in the field of medicine. The reflection is really important. It's important in your essays, but I would say it's actually even more important in your actual interviews. If you're not able to reflect that well, you may not be ready for a practice in medicine. For medical schools, this is like their biggest sign of seeing like, you know, do you have that maturity to be a medical student, right? Like it's such a huge responsibility and even a greater responsibility to become a physician. So by reflecting, you're able to not just like understand your specific issues, but think about like, how are you going to work on them? So, for different questions like the weakness question, tell me about a time you made a mistake, or like tell me about a failure. A lot of these people see them as traps. And I think the internet has also made it appear as traps. They're not traps, like at least not in the medical school environment. They really just want to understand, have you encountered this and how do you navigate that? They're not trying to be like, oh, this person made a mistake. And so, like, we're not accepting this person, right? Or this person has a weakness. So I think a lot of people get this idea wrong about the medical school interviews. They really just want to see that you have that maturity to recognize when, you're not super strong in something or you did something wrong, and then talk about what your plan is to actually move on from it. Um, the other thing I would encourage you to do is like storytelling. I think a lot of people, well, one, I think on the internet, they do tell you that stories are important, and that's not wrong, but I don't think people do a good job of telling you how to story tell. A lot of the times I get these stories that are really like long-winded. There's a lot of detail in there, and the answer is like 3 minutes long, and I'm just sitting there like, what are you trying to tell me? Like, what am I supposed to take away from this? And I will actually ask a lot of my students that if, I'm not really sure what the point is. It is really important to be succinct, right? In writing, you're able to go back and reread things that you may not have understood. I don't have that ability as an interviewer, right? So I take a lot of these things at face value. So when you tell a story, you want to make sure you cut out all the fluff. Like, I don't care what color the blanket is, right? I don't even care that there's a blanket there, right? I just want to make sure that I understand what is your interaction with the patient, right? What did you do? Or what was the issue? How did we solve it? Or what was the situation? And then, again, the biggest thing, reflecting, making sure you discuss things like, what did you learn? How could you apply what you learned to like your future practice, right? Or what would you have done differently? If you hit on these points clearly, then again, it shows that you've actually taken the time to think about these things and improve yourself, which again, a sign of maturity. The delivery of your answers, lastly, I think this is such an obvious one, but I get asked about this all the time. There's a couple things like fillers. A lot of people will say things like or like. That's not a bad thing, but if you're starting a sentence with like my my interest in medicine is like it makes you feel really, it makes you appear really unconfident about what you're actually saying. So again, your goal is not to try to eliminate all of those answers, or sorry, not all of those filler words, but to really just be cognizant of how many you're using. A few here and there, totally natural, right? I try to get people to slow down and try to pause. So, I will sometimes use or like, but if you notice that when I talk, sometimes I'll take different pauses, it's because I have kind of trained myself to not say as much. Another thing is, one time a student told me, um, I don't know, they were just kind of talking like this, all the time. And I was like, why are you like moving your hands so much? And they were like, it feels really boring to kind of just sit and be still. And I was like, okay, so if I'm like talking like this, like, is this better? Like, it's really distracting. So I'm personally a fidgeter. I'm always moving my hands. If you're on a Zoom interview, you have the ability to put them under the table, right? So these are strategies that you want to be cognizant of. Eye contact is like another big thing. I encourage you not to have notes. I think they're just a crutch, right? Like really just practice these questions and practice like being spontaneous. It's okay if you don't have, a whole script written out, right? And in fact, that's actually better. But if I don't know, if you like, if I look like this, right, and I'm looking like this all the time, again, people pick up on these things, and then it just makes me think like you didn't prepare well, or like you're reading off of something, and it just kind of leaves like a bad taste in your mouth. So try to avoid things like that. All right, and then different questions. I'm not gonna lie, these aren't like the most like mind-blowing like set of questions, but these are the most high yield questions that you're gonna see. We talked about quite a bit of them already, but these are pretty standard. Occasionally you'll get some different curveballs. They may follow up with, some of the things that you're saying. So again, it's very hard to predict 100% of what you may expect in like these types of interviews, but this is pretty much what I would anticipate. And then we'll spend a little bit more time here talking about the different types of MMI questions. So I think rather than just putting categories, I just wanted you guys to like understand like what does like the scenarios look like, right? So if you're reading the first question, you might be like, oh, I already know this, right? Like that Spanish speaking patient that I had worked with like definitely fits. It's not as simple as that with MMI. Um, they really just want to see your logical approach. So I think for most people, when they see this, I usually start with like harder questions than this. And so by the time we get to this, they're like, oh, I know this one. I'm going to order a translator. That's not what they're looking for. Like, they're not looking for you to necessarily solve anything. They're looking for you to show how are you logically approaching it, right? So questions I would ask someone is like, okay, I know you know how to order a translator, like that's not hard, but why are you ordering a translator, right? And they're like, so I can communicate. I'm like, okay, good, but why is it important to communicate with your patient, right? So as you're delivering your answer, it's really important to talk about all of these aspects. Again, the biggest thing in MMI that I teach people is you cannot assume anything. So if you're not telling me that you understand cultural awareness or the importance of communication with your patients, I can't assume that you know. All I can assume is like, you can call a translator, but you don't need a medical degree for that. Okay. For ethics, um, one of the questions that I get a lot is, are they going to ask me something super controversial like abortion or euthanasia? Those are very like old school questions, like even in the medical school realm, like I don't really see those questions anymore. Once in a while, like you may get that, but I would say, especially abortion is like way, way, way too controversial. And especially with the politics now, I don't think you're going to get like a ton of diversity questions, but I think a lot of schools are going to stay away from that. The vaccine question used to be, it used to be an acceptable question, but I think now given like all the politics like surrounding it, I don't quite know if it's going to come up, but in the recent past, I will say it has come up. So for ethics, again, with this question, I mean, depending on what your background is, like interviewing, or have you seen this before, a lot of people will just jump to like, I'm just gonna report them. And I'm like, oh, okay, like you don't want to try to even understand like why did they cheat, right? So again, it's not about saying what you think they want to hear or like having a straight solution. Again, show your logical process about like how did you come to the idea of deciding that you're going to report someone or not report them. Sometimes you'll also get these like quirky questions. Not always, but like you can. I think with the Casper, you definitely see a lot more scenario and like quirky type questions. These questions are just designed for you to like think on your feet. Um, they're more like personality questions. Like they don't quite mean anything. Like in my residency, sometimes they'll ask about like, what holiday would you create? And I don't think that that's gonna be a life-changing answer if someone's like, I would pick a cat holiday, you know? But you don't be weird. Like I remember one time I asked someone like, what do you do for fun? And they were like, I like to work with blood samples. And I was like, that's a definite red flag. You know what I mean? So um, with these questions, keep it light, think on your feet, don't be weird. That's the best advice I could give you, and just understand like these questions don't really count for much, but if you're weird in them, then it can hurt you. And then lastly, healthcare. This is going to be the most common way that you're going to see a healthcare question. And sometimes I'll get asked like, what exactly do they mean by like a healthcare question? That usually refers to healthcare systems or insurance, right? So again, now that you guys have time, like look into that. Um, I don't know. My students have access to like my healthcare guide that I personally wrote. It used to be for sale, but unfortunately another company tried to steal that work. So, now it's not. They kind of just ruined it for everybody. All right. So I hope that was at least like kind of a good primer for you guys. I was just going to spend the rest of the time asking questions. Sorry, not asking questions, but answering questions for people. A lot of you guys like submitted questions in like your registration. So I'm going to pull that up. But if you guys have specific questions that you guys want me to answer here, feel free to drop that in the chat. So let me pull up. Somebody asked, do you take students only for interview prep in the upcoming season? Um, yes, I do. I have a team that I work with. My schedule gets packed very, very fast. One, because like I don't have a ton of time. But also, I do have like my set of students to make sure like are super prepared for this. So if you want to work with me, just let me know early. Okay. For the person asking me about interview prep, just shoot me an email and then we can chat more about that. Okay. Um, so in the question list, people asked how to answer certain questions, which I think we like covered pretty well, and then what officers like to see. I don't like people having this mentality of what people like just saying things that people want to see. I would say the most important thing that you can demonstrate is your passion and preparedness. Your delivery, I think, has a very, very big factor in, showing your passion. So it's not so much like that you've done a million things in your application. I think it's more so what you or like how you've shown it or like what you can demonstrate, like, in your little monologue when you answer the question. I think it's very like, when you talk to somebody, I think you can just tell, like, do they really care about this or not, or do they kind of just regurgitate something? So, for example, if you're telling me about volunteering and you're like, okay, I volunteered at this hospital, I worked with some patients. I'm like, okay, like, what do I do with that information, right? But if you are like, I've really connected with these patients, but I noticed that a lot of them mentioned that they were cold because they're getting chemo treatment. And so I created an initiative to help my patients by collecting blankets and socks and warm teas to kind of bring them some comfort, during these treatments. And then, you talk about like the results or like what you gain from it. I feel like that's a lot more effective than just saying that you did it. Um, okay. And then somebody asked how to distinguish answers from why medicine to why physician. Personally, I think these are the same category. The only thing that I would say is a little bit different is, I mean, essentially you want to become a physician because you want to do medicine, right? So that's why I kind of think they're the same. You could get asked about being like an NP or PA, like that's something that I've practiced with a lot of people this week. Um, for, I mean, again, I think if you're trying to just specify like why physician, I would think about what led you there and what do you see yourself doing as a physician? Like, again, think about in a clinic, how do I see myself practicing, right? It's not just as simple as like, I'm going to treat the patient and I'm going to listen to them. But, the way that I've explained it to everyone is as a physician, we're all trained with the same standard of care, right? So, for example, if you have diabetes, we know to collect an A1C, check your sugars, recommend insulin, right? But the way you deliver that care is very different. So, for example, there's, if a patient comes in and you see this like A1C getting higher, meaning like the diabetes is getting worse, some people might just be like, okay, we're going to titrate the insulin, right? I don't do that in my practice. I first understand like, why is it increasing? Like, is my patient not able to like get food? Is, are they depressed and they're not able to actually like administer the medication every day? Do they just not know what diabetes is? Because like, like I get this question like a lot, like what is diabetes, right? It's like, so sometimes people are like, yeah, I'm eating like 3 tortillas per meal. I'm drinking a soda, at least like one soda every day. That person clearly does not know what's causing their diabetes. So I try to focus more on nutrition first rather than just like titrating their medications. And so again, same patient can have very different outcomes with like different physicians. We all know the same standard of care, but again, I choose in my practice to be a little bit more holistic. And then in terms of the why medicine, again, I feel like it's very similar, but I would think about like your experiences and why you gravitate a little bit towards medicine more than like other fields. And I specifically said the word gravitate a little bit more because you can have other passions. And I think that's such a mistake that some people make where I'm like, ooh, this is interesting. Like you did journalism. Tell me about that. And, they're very just quick to say, oh, well, I like journalism, but I'm really focused on medicine, right? Just because you're a doctor doesn't mean you can't have other passions. Like my passion is entrepreneurship, which is why I started this company. But for other people, they have, one of my co-residents is like really, really passionate about music. So he actually owns like a music school, right? On top of being a physician. So it's okay to have different passions. But I would say think about how all of these things could potentially be integrated. Okay. And again, people who have passions are a lot more interesting than your type A pre-med who gets straight A's and has like a perfect SAT score and just wants to diagnose, right? There's so much more to this field than just that. Hopefully that answered your question. Um, Again, if you want to work with me, just shoot me an email. Like I try to keep these separate from, people who just want to work with me. Um, Someone asked about the NP versus PA. Is it okay to focus on an interest of becoming a surgeon, um, or having broader reasons, or should I also include broader reasons? Okay. So basically they're just asking like if you know that you want a specific specialty already, how do you approach that? So I think for a lot of these specialties, you can't really go wrong. The ones that I'm a little hesitant for people to be very upfront about is if you want to do dermatology, plastic surgery, or neurosurgery. One, the neurosurgery route is so long, and I know like, you guys like are interested in it because it sounds really cool and it's gonna make you the most money, right? But that's not a good reason to go into medicine. For dermatology and plastic surgery, it does have that connotation of like being a little bit more superficial. But if you talk about it more from the medical perspective, so for example, reconstructive surgery, right, as a plastic surgeon, or for dermatology, like skin cancers, I am more okay with that. Um, if you want to do something in the primary care field, I feel like that tends to be like a very safe answer. Surgery, I think, is also a very safe answer, but I would caution everybody, whether, you want to do primary care or like one of the specialties, I would just caution you to be open-minded. So you can say, I'm really interested in becoming a neurologist, but I am still exploring different options, especially if that's the only thing you've done, right? Some of my students like have shadowed like 9 different specialties, and I'm like, great. If that's the case, then, you've kind of already have an inkling of like what you might gravitate a little bit towards, but you want to be able to discuss what made you gravitate towards like that one specific specialty, or how do you see yourself in that? How to answer why not PA or dentist? Um, I mean, that's going to be like a longer conversation, but essentially you want to think about like the different nuances. PA is very close to being a physician, but I would encourage you to think about like why the length of training matters versus a PA that doesn't have to go through like a residency, right? And also scope of practice, right? For dentists, you'll hardly get this question unless dentistry is actually on your application, right? So if half of your application is, you working at a dental practice and then you're like, I want to do medicine, that makes it a little bit confusing. So you may get asked that. Again, it's not necessarily a trap, but you want to be able to discuss like what made you want to do medicine more than dentistry. Dentistry is just focused in the mouth, right? As a doctor, you're basically responsible for taking care of the whole body. There are some things that overlap, like, some of the social issues like could overlap. Oral health can definitely affect like cardiovascular disease or strokes, right? But again, your scope of practice is much, much wider as a physician. Um, what did what do you do if you don't know what specialty you want to go into? That's totally fine. You don't have to know. That's never a requirement. So don't freak out about that. If you don't know, that's okay. You just have to know what you like. Again, how do you see yourself practicing as a doctor, right? Like, how are you going to interact with your patients? You don't have to come in knowing, and even if you do know, med schools know that you're going to change your mind, right? Like for me personally, I had such an amazing dermatology mentor, and I went through all of med school thinking I was going to do dermatology until I did my rotations. And I was like, I actually don't love this. And so, I did family medicine, and I never, like, if you asked me before, I never would have said I would have gone into family medicine. And now, like, as I'm graduating, I have the option of, practicing dermatology because I'm going to go work at a dermatology practice, but I want to start my family med practice there. Like, I don't see myself just practicing dermatology. My friend who was like so into pain management was like all about pain management even into residency, and now she's in her third year of residency, and I was like, are you applying for fellowship? And she was like, absolutely not. Like, I realized I actually hate pain medicine. And so you know, she's very happy just being an anesthesiologist. All right, if you're asked to briefly summarize your research, how in depth should you go? um, just remember, you might be the expert in your research, but the person asking may not be. So you don't want to use um, very heavy jargon. So for example, if I said, my research was on dendritic T cells in murine models. You know, does that mean anything to you guys? Probably not. But if I rephrase it as, you know, I specifically looked at wound, like how wound healing occurs in mice models and how it might be applicable to patients and diabetics, that is a lot easier for your interviewer to at least understand. And again, they're not asking you about the subject of the research necessarily. The questions are usually more directed at, you know, what have you done in that research capacity? Okay. Still know what your research is about, right? But always kind of assume like you're going to be explaining it to like a fifth grader. Aside from filler words and using hands or talking, is there any do's or don'ts and must avoids while interviewing? Like things that could lower your chances or leave a bad reputation? The thing that comes the quickest to mind is putting somebody down. Whether, especially like if it's like nursing or like physical therapy. Like I've once had someone say like, "Oh, I'm not going to be a nurse because that's beneath me." Like, I mean, if that was like your third question after tell me about yourself and why medicine, like it doesn't matter what you say after that. Like this was like automatic, like you're probably not going to get in, right? So never put anyone down. I always tell my students like, if you're telling a story, and even if it was somebody else's fault, always chalk it up to like it was a miscommunication or like you had something wrong to do with it, even if it was not you. So you want to be very, very careful about throwing people under the bus. Like sometimes people will tell me stories about like, yeah, I was working in a team and you know, this person did not complete their task, so I had to take over their task. And, you know, to you, you might think like, well, this is what happened, right? And I'm not saying that that's not true, but, you know, it kind of makes you come across as like a really unpleasant person to work with, right? But if you're like, you know, someone wasn't able to complete their task and I like took the time to really understand why and see what they needed help with. And so, you know, I stepped up and I offered to like help them with like these specific tasks. Like that makes you appear way more collaborative, right? And so again, same story, but different presentations is super important. Um, there's I don't know if I can think of like a ton of other like red flags like off the bat. Just if you're doing things in person, just make sure you are like kind to everyone. Like if you're going to like REMS or Penn State, right? Like even the janitor has like a say. Like there's definitely been people who like get taken off the list because they're not nice to like the support staff. Um, I think again, just the delivery of how you're presenting the information is going to be important. And then I would say the biggest thing that is like really going to take you out of the running though is like not being able to articulate your goals or some of the things that you've done. Like, you know, for example, and someone asked me this last year. They had gotten like their seventh interview and they were like, have you ever seen anyone get seven interviews and not get in? And I was like, oh yeah, definitely. Like a few years ago, I had a student who I think was just like so rough with like interviewing. And when I would ask them questions, like, why do you want to go to medicine, right? Like the answer that I got was, I want to make people happy. And I was like, okay, like what else? And that was it. They just wanted to make people happy, right? So, something like that, it just feels really obvious, like that person is probably not going to get in. But yeah, and if you haven't done your homework on like a specific school, like if they're asking you, why do you want to come here? And you're like, oh, I like the community service, and that's all you can come up with, like, you can just tell that that person's not super interested. I've done some research. How do we answer what is next on this research? Might be better for like your research mentor. It is important though to, I think critically about like what gaps you have, right? Like research, you're only targeting a really small part of that specific subject, and there's a lot of different unanswered questions. So again, like your research might reveal something, or not, but then you should be able to talk about like, okay, knowing this, like how do I move forward from that? Um, Other than recording yourself and rewatching, any tips on articulation and delivery? I think with practice, you just naturally get more confident in what you're saying. Um, Practicing your stories, which I know I'm like just kind of saying the same thing, but like practicing your stories, I think is really important. Um, the recording yourself and rewatching is like not just that. I think it's like how you utilize that. Like you really want to think about things objectively, right? Like you obviously know all of your stories, but if you're thinking it from the perspective of like, if someone doesn't know me and I am saying this information, like take it at face value. Does it make sense what I'm saying? Right. And I will say for a lot of people who are new to interviewing, they don't know what they're saying. So as you practice these things and refine it, like be very, very critical of, am I giving enough information? Am I giving too much information? Does this clearly articulate my goal? And a practice that I have a lot of my students say, or practice is like after our like interview session, I'll ask them like, what do you think? Like, what could you have done better? And a lot of people have different feelings about this, right? But with different questions, I'll also ask them, like, what do you feel like I was trying to ask? And they will think about, like, okay, I think you are trying to ask me about like hardships in medicine. And I'm like, okay, do you feel like you answered that question? And sometimes they're like, no, right? So thinking about what the question is rather than just like running through the questions, I think is really important. Get into the mindset of your interviewer. Like, why would they be asking different questions like this? Um, what suggestions do you have to prepare for LECOM's video interview? LECOM's interview is a little like MMI. They will ask, like, obviously, why medicine still. So definitely practice that. And I believe there's a time limit. I think it's like 90 seconds per question. So just make sure, like, things are timed. I would suggest practicing some like ethics as well, because that also does come up there. Um, how would you recommend answering why an accelerated program? Again, like anything that has to do with like specific questions. It These are going to be like much longer conversations, so I'm sorry if I'm not like answering it directly, but um, I'm going to throw the question back at you and be like, you should think about like why you want to do an accelerated program, right? Like an accelerated program is not easy. It sounds good, but there are like drawbacks to that. And so I think if you take the time to understand like what those drawbacks are and also understanding what is your motivation. Again, this all comes back to goals. If you understand what your goal is, how does that play into like an accelerated program, right? So with any of these questions, like really think about like the well, the way I phrase it is like risk and benefits or like pros and cons of like what you're doing. What questions should you ask the interviewer? Should they be fun questions, like three wishes? Oh, definitely don't ask them about like three wishes. Um, and I wouldn't really ask them when you will hear back. I don't think it's a red flag or anything. I just think I don't know. Like, I think if it were me, I would try to be a little bit like more chill. Like, you want to have questions that actually engage them. You can ask them about yourself or about themselves, right? About like their favorite thing about teaching there, about like the culture of the school. If you look something up, um, have very specific questions. Like it can't be obvious. Like, do you guys offer research? Like, of course they offer research, right? So just be very specific about like, I was looking up this specific program and I couldn't find that much information or I had a question about it. Like that's a solid question. Um, yeah, again, culture, what to expect, things about themselves, traditions, curriculum, mentorships, like, a lot of things are fair game. Don't overthink it, but also don't be weird in your questions. Um, there's no interview for Brown. So, very, very few people I think will find out about PLEMI soon if you guys ED'd. But I think most people will hear back in March. You don't really get interviews. The video, the like 90-second video is like pretty much the replacement for the interview. Has Brown video portfolio made a difference? I personally don't think so. I think they're just trying to see a little bit about you, but I personally don't think it's going to be a drastic difference. Is it harder to get in without it? I don't think so. Um, I mean, I'm not gonna lie, if you look on YouTube, some of these videos are very average, right? Like there was a kid I remember who was like, I have COVID and I'm quarantined, so I'm just gonna like show you around my room, and that kid got in. So I don't think that it like really makes that much of a difference. The 90-second video is just like an introduction about yourself. You can talk about anything. There's a million videos on YouTube, and they're all extremely different. Like, I don't think there's any one thing you should talk about. Like, I mean, again, if you know me, you just know that I would not recommend just talking about tennis, dance, what are the other things I say? Swimming, playing the piano or the violin. Like we just like we've seen a lot of videos. Like I just feel like everybody talks about those things. Like, talk about your hobbies and don't spend too much time talking about your family. Like this is about you. Um, so yeah, hobbies, big highlights, passions, interests, what a day in your life looks like is cliche, but I don't think it's like the wrong type of format either. And yeah, like, try to make it a little quirky, but again, like that 90 seconds is not going to be the most life-changing 90 seconds to your video. Do you have any tips for NJIT? NJIT is very um nice to you. Um so it's actually a very nice interview to have as like a first interview. They are not mean. And it's very conversational. So again, like practicing the questions that we talked about, like, let me see. Oh, I passed it. Practicing like at least these questions should get you through like a lot of the questions, but I mean, they're just really interested in getting to know you. Like that's really all I have to say about that. They're not here to really trick you on specific things like that. All right. Um, Okay, another NJIT, the 90-second video portfolio, that's the same thing that we're like talking about. Do you feel like it's safe to skip it? I mean, honestly, I don't know because I just everyone that I talk to has decided to do the Brown video, so like I don't necessarily have an opinion on it. If you don't want to edit, that's fine. There's another option for you called Glimpse where you just shoot a video like this, right? Like you just do it in one straight shot. There's no editing, but they put that option there. I will say most people have opted for video editing, but I don't necessarily think it's something that you have to do. Like, but I wouldn't forego it because if everyone is doing a video portfolio, I would say the minimum that you could do is at least like do the glimpse. Does NJIT ask about research? Um, I'm going to leave it as like it depends. It depends if your interviewer cares about it or not, right? Like if they don't care about it, they're not going to ask, but you should prepare for everything. Um, do you have any interview tips for Rochester? Yeah, I do have a lot of tips for Rochester. I'm very close with like the students who go to Rochester now. Um, Rochester is really interesting because it's in person. There is also a group interview, so like you also have to know how to like navigate that as well. And like it is really hard to practice in like a one-to-one setting. But again, I think, like it was interesting because last year I like prepped like 10 of the 50 people who got invited. And then like my three students got in and it was very obvious like who was going to get in. And so like I'm not going to say like I mean I love my students and I'm like very very close with them. I don't think it's the fact that they did anything like like super out of pocket, but I think they were just very authentic. Like I have people who I think had even better resumes than them. And don't get me wrong, like they have great resumes, but I have people who have even better resumes who didn't get an interview. And, for people who did get an interview, honestly, I think what made those like three people stand out more was how they were actually able to articulate why they wanted to do something. And again, no in healthcare from me is extremely important because like I think there was maybe like a conversation about that. And so um, yeah, I mean, again, there's no one can really touch my students when it comes to like healthcare just because like they know so much about it and they're able to like articulate that really well. Um, does Pleme have certain preferences for exams? Guys, I'm not gonna lie. Brown, super random in like what they want. Like people who do extremely well in the cycle may not get into Brown, and then people who have gotten like nothing in terms of interviews may get into Brown. So I don't think there's any like one specific thing they're looking for. I think someone even said like, like a year ago or something, like someone got a 1350. Brown is not like your other schools. And again, it's very, very hard to predict for a lot of these schools what they're looking for exactly. But, I've seen a lot of different profiles for Brown. They're not consistent at all. We do know that they like interdisciplinary. Your exams, I think, have to be strong, but I think they can be passable and be made up for by like your passion and like your perspective. But, I know there's a lot of anxiety around Brown, but if it happens, it happens. Like I feel like that's kind of my motto for this year. Um, inner or tips for group interviews. Um, my best tip for a group interview is don't try to be the person that stands out. And don't be the person that everyone can talk over. Try to be in the middle. Um, I personally feel like I always get selected when I'm like in a group interview because I always take the time to listen and respond. So I'm neither like the person who like always raises my hand first, right? And I think that like that's a lot of people's advice to actually do that, but you don't necessarily need to always raise your hand. And if you keep trying to talk when other people have not, that can also be a red flag because again, it shows that you're not really collaborative. Rochester asked for a family peer letter. Um, who should write those? I'm not gonna lie, last year I don't think that any of my students like did this and they were fine. If you do, someone who can write really nice things about you, I would not necessarily say like a parent unless they have something like like a really interesting like life story that maybe like you haven't been able to touch on. But I personally feel like friends or mentors um, could potentially be like a better fit if you choose to do it. Okay. Okay, so we went over time. But if anyone has last minute questions, like I'm happy to stick around and answer them. But otherwise, um, yeah, I mean, good luck. You know, reach out to me if you guys want to work together. But yeah, I know again, it's really stressful, but I feel like you guys will end up where you guys are going to end up. It will all work out for the best. And that's actually like something that my REM student and I just talked about like last week, where she was like, I crashed out at like midnight like so many times. And like, it's just crazy to think like I'm at where I'm at. And, that's so true for a lot of people. And, just regardless, I just want you guys to remember like there's so many different pathways to becoming a physician.